Hello, my name is Amalya Jones. I'm a senior psychology major, and my research proposal focuses on enhancing immune function and expecting mothers to prevent schizophrenia. Schizophrenia is a mental disorder that affects 1% or 24 million people worldwide. The age of onset is 18 to 25 years old. It is characterized by positive symptoms, negative symptoms, and cognitive symptoms. Schizophrenia is a neurological disorder. The picture on the left comes from a study from the University of California showing brain regions associated with schizophrenia. The top figure is a brain with blue highlighted areas showing decreased activity in the prefrontal cortex. The bottom figure shows red highlighted areas showing excess activity in the basal ganglia. The picture on the right explains the dopamine hypothesis. Dopamine is a neurotransmitter that controls pain, pleasure, attention, alertness, and memory. The dopamine hypothesis states that people who suffer from schizophrenia have excess dopamine in their brain. These brain abnormalities change a person's personality and is related to psychosis seen in schizophrenia. The immune system changes during pregnancy. Pregnant women are more susceptible to viral infections like influenza. Microglia releases cytokines in response to these infections in the immune system. These proteins cross the placental and fetal blood-brain barrier, which disrupts fetal neural development. A study by the University of Hong Kong administered a virus to mice to increase immune system activation. This caused sensory motor gating in the mice. Sensory motor gating is impaired central nervous system inhibition seen in patients with schizophrenia. This shows the links between maternal infection and fetal brain development, leading to long-term structural and functional issues in the brain. The research question is, can strategies to enhance immune function in expecting mothers prevent schizophrenia? The hypothesis is strategies such as diet, vaccinations, and antibiotics can enhance immune function in expecting mothers by reducing maternal cytokines because maternal infections are associated with an increased risk of schizophrenia. Participants are recruited using volunteer sampling. 100 pregnant women will be recruited from advertisements in obstetrician and gynecologist offices. A positron emission tomography is used to view microglial activation and cytokines in pregnant women. Analysis program ADNI is used to interpret the PET scan data. A magnetic resonance spectroscopy is used to examine dopamine levels in the fetal brain. Analysis program MAR and NBK is used for the MRS data. This study is a longitudinal experiment with between subjects design. The independent variables are immune enhancing strategies. The first level is a strict routine, which includes a dietary plan with micronutrients, vitamin D, folic acid, iron, as well as prenatal vitamins. This first level also includes immunizations and antibiotics to fight viral infections. The second level is a no routine group that has no schedule or plan regarding diet, immunizations, or antibiotics. The dependent variables are cytokine production and dopamine abnormalities. The procedure for this research proposal goes as follows. The participants will sign consent forms to participate. There will be a fully equipped lab with licensed doctors, nurses, and researchers. The women will be randomly assigned to a strict routine or no routine group. A Philips Healthcare PET and a Broca MRS machine will be used. The women will be scanned after their second trimester, their third trimester, and months after birth. The data will be analyzed and compared. Participants will be debriefed, compensated, and thanked for their time. Benefits of this research is finding strategies to enhance immune function in pregnant women, and also further evidence linking maternal infection and schizophrenia. A risk of this research is the effect the PET or MRI scan can have on the mother or child. Thank you for your time and your attention.